I would like to ask the Minister for Health and Social Care how a significant reduction in speech and language therapy in schools will be implemented this month, and if he will make a statement.
On the Minister to reply, Mr Ashford.
Thank you, Mr President. In December, a letter was sent to the Island schools by the Department's clinical team lead for children's therapy, advising them of changes to the provision of speech and language therapy in schools. The letter, I believe, has been helpfully circulated to honourable members by Mrs Caine yesterday. The letter informed schools that the changes would come into effect in the spring term of this year. Some internal restructuring, a growing caseload and a shortage of professional resource led to the conclusion that for a period the current level of speech and language therapy support in schools cannot be maintained. The service delivery for preschool and reception age children with complex speech disorders is being prioritised, ensuring that early intervention continues. And I think that is absolutely crucial, Mr President. This will help children to be more school ready and allow them to access the curriculum with a minimum of support from educational professionals. The change in service will affect mainly children in Key Stage 2 and above, as new referrals will not, for the time being, be able to be dealt with. We are monitoring the situation carefully and focusing on providing speech and language therapy support to those children with the most need. I have also, Mr President, instructed that a thorough review be undertaken of this particular service, with a focus on ensuring that the resources available are appropriate to the projected demands for the service going forward.
Supplementary, Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr President. I'd like to thank the Minister for that answer. It's somewhat concerning that more and more we seem to be hearing from the Health Service phrases like, for a period of time the current level of service cannot be maintained. It surely isn't restricted specifically to this service. So my question for the Minister, two questions really. Is this part of an ongoing process where the Health Service is quietly cutting back services without really engaging properly with service users? And secondly, how long will this particular period be where the current level of service cannot be maintained, and when is it expected to be back up to standard?
Minister to reply.
Thank you, Mr President. Straight answer to the first part of the question, which is no, it isn't. In relation to the reasons behind this, just to give a bit of background, Mr President, there is currently vacancies within the service. There is currently a 0.5% role, and also there's a maternity leave that is coming into play. Now, obviously, we need to try and get coverage for that. That is one of the reasons I've asked for a review of the service, because to my mind, looking at the detail of the service, I believe they are running close to the wire in terms of caseload. Caseload has increased quite substantially over the years, and the important thing is that we now look at what the projected caseload is going to be going forward, and if we need to be looking at putting more resource into the service, then that is what we will have to do. In relation to the staffing levels, in order to get the service back up to where it needs to be, we would need to see an additional 0.5 equivalent band 6 within the service, and as part of the review, that is something that I've asked to be looked at, Mr President.
Honourable Member for Garff, Mrs Caine.
Thank you, Mr President. I thank the Minister for his response and also for the undertaking to have a full review of the service. But I do have some concerns, and I wonder if he would let us know how many staff are within this service currently. What would the full strength be to meet the current needs of the service? And given the letter that was circulated to primary schools, how can this team of whatever manage to absorb an additional 150 additional cases and still continue to deliver a level of service that one would think that this area of therapy requires?
Minister to reply.
Thank you, Mr President. Once the maternity leave kicks in for the individual who is going off on maternity leave, which is a 0.6 full-time equivalent, there will actually be 2 full-time therapists within the mainstream team. So in terms of caseload, though, I do need to point out that, for instance, we have seen dramatic increases in caseload over the last few years, and so it is important that we do review how we are delivering this service. Obviously, I do have concerns myself that a maternity leave, which should be planned, if that is going to impact on service provision, and that is why I have asked for a full review of the service. But I think the important thing, Mr President, is that we are prioritising the early intervention, because that is absolutely key. That is where the bulk of the service provision is, and that is what we are maintaining. Because although there are cases that emerge within Key Stage 2 and later, the most prioritised stuff, as far as I'm concerned, is the early years and ensure that those children are effectively school ready. We have given the undertaking that that will continue, that will be prioritised while we are reviewing the service and seeing how we can again expand out into offering not just the service we're currently offering, but perhaps even an enhanced service compared to what we've been offering recently.
Mr Speaker.
Thank you. The Minister stated that Key Stage 2 was likely to be the most affected age group, and I was just wondering if you could perhaps expand a little bit on what sort of service demand will go unmet as a result of the shortfall of staffing.
Minister to reply.
Thank you, Mr President. I should make absolutely clear that in relation to Key Stage 2, it's new referrals, so new referrals will not be being accepted. Obviously, it's very hard to predict going forward what any new referrals will be, because normally new referrals would be people joining the school-age population who aren't already in there. The people who are already on the list, my understanding is that that will continue for the time being. But that our priority is obviously reception and Key Stage 1. The other thing I need to make clear as well about the Key Stage 2 and above is that they will be still accepting referrals for stammering. So that service within the Key Stage 2 and above will still be being met.
Honourable Member for Aaron Michael.
Thank you very much, Mr President. The Minister in his earlier answer referred to a dramatic increase in demand in recent years. Does the Minister understand, or his department understand, what's actually driving that dramatic increase in demand, and whether that's perhaps causes that are maybe outside the department's areas of service provision? And if it is, are we taking a sufficiently holistic view of service provision to ensure that we're not saving money in one area and effectively incurring it elsewhere? And I'd just be grateful if the Minister could share his thoughts on that.
Reply, sir.
Yes, thank you, Mr President. In relation to demand, obviously demand does fluctuate across the service, but we have seen increases in demand and caseload, and it's very important that we properly address that. In relation to what's driving demand, I mean, in terms of speech and therapy, to be perfectly honest, they're generally individual situations. So it's very hard to necessarily identify one core demographic or something that's driving it. It really does depend on a year-by-year basis as to which children are coming into the school. That's why, as I say, Mr President, the important thing from this, while we do review the service and while we look at how we want to move the service forward, we focus on those children in reception and Key Stage 1, because they are absolutely crucial. If they do not get that early intervention, then that causes problems further down the line. So we are focusing on that, and there will be some disruption to Key Stage 2 and above, but I believe we're taking the right approach in saying that rather than actually during this temporary period splitting off across all the different areas and saying there'll be reduced demand, we are continuing to deal with Key Stage 1 and reception, and although there will be a temporary disruption to Key Stage 2, I believe we're taking the right approach.
Honourable Member Mrs Caine.
Thank you, Mr President. I've got three questions actually for the Minister. Firstly, he is saying that, and it really concerns me, that there was no business case apparently done for a planned maternity leave, reducing the service provision to, I think he said, 2 full-time therapists. Can I ask, as well as absorbing that 150 additional cases and not taking any new referrals from Key Stage 2 and above, what is the total caseload for the remaining therapists in that service? The second matter would really be, has this been done in a joined-up way? Does he appreciate and accept that there will be an impact on the teachers within the schools who feel or find from Key Stage 2 above or at any age that there is a speech, language or communication issue? and that they are no longer able to call in or receive the level of support from the trained professionals in that area, and that could have ongoing emotional or medical requirements for those children. My final one is to ask the Minister if he's aware of the recommendations or the report of the Burco 10 years on report, an independent review of the provision for children and young people with speech, language and communication needs in England. It makes very strong recommendations to the UK government and system leaders about what must change to improve the situation there, with a focus on solutions, and presents examples of effective practice. Is that something that the department will be reviewing when it reviews the service? Thank you, Mr. President.
Minister to reply.
Thank you, Mr. President. Taking the last one first, I am aware of the particular report that the Honourable Member for Garff refers to. In relation to the review of service, it is exactly that, Mr. President. It is a fundamental review of the way that we deliver the service. So obviously things such as that will be taken into account, and the way that we structure the service going forward. In relation to caseloads, the mainstream caseloads, so across all ages, I've been advised this morning, is 302. So effectively, after the maternity, or the person goes on maternity, the 0.6 role, that would leave 2 full-time therapists in the mainstream team. So effectively, they would have 150 children on each of their caseloads. That obviously, from my point of view, is a very large caseload for people to be handling. I do need to clarify again, Mr. President, that we will be looking to try and bring in maternity cover, but that does need to be recruited too for the maternity post. And I think we do also need to look at the staffing levels within the service to ensure that if demand continues to rise, that we have an appropriate level of demand, appropriate level of staffing to meet that demand. In relation to are we doing things in a joined up way, Mr. President, I do believe we are. We have been liaising and working with the Department of Education on this to try and ensure that what we can do is minimise any disruption in the short term. I believe that we are minimising that disruption. I think most honourable members would agree that the key to most things within the Department of Health and Social Care is early intervention, be it mental health, which we'll be discussing later in this sitting, Mr. President, or indeed this service. And that is why we have taken, I think, the very sensible and joined-up decision to make sure that we maintain and do not disrupt that early intervention, which when it comes to children, particularly at the age of reception coming into school, they are not disadvantaged because of the demands that they need for speech and therapy.
Final supplementary, Mr. Hooper.
Thank you, Mr. President. The Minister earlier said that the reduction in service is primarily going to impact new referrals and that those already inside the service are still going to keep receiving it. The letter, on the other hand, that was circulated directly contradicts that and says that the letter and the changes will concern both children both currently referred to the speech and language therapy and future referrals. The letter also goes on to say that in respect of Key Stage 1, so reception and Year 1 classes, that there will be no direct input for children with language difficulties, only those that have complex speech disorders. So I wonder if the Minister could perhaps clarify his earlier remarks and tell us exactly what service is going to continue to be provided.
Reply, sir.
Yes, thank you, Mr. President. I am happy to clarify. The information I have in front of me is that in relation to reception Key Stage 1, new referrals will continue obviously to be accepted, and that children will be assessed and those requiring intervention will be placed on a waiting list for therapy. At the moment, the current waiting time for appointments for initial assessments is 4 months. I'll clarify that. In relation to Key Stage 2 and above, the information I have in front of me is that its new referrals will not be accepted and that the list for new referrals will be closed, but that referrals for stammering will continue to be accepted. That's the information I have in front of me, sir.